I'm Marjorie Brooke from Brooke Seminars Bodywork Education and author of Flexibility First, a Fitness Approach for Life. Today we're going to show you a couple of stretches out of Volume 5 of the Professional Series, which deals with the hip. Okay, we're going to show you two stretches that are very useful when dealing with lower back pain or sciatica. So the first what we need is to have our client supine on the table. We're going to have them seat belted in so that they can't compensate using their upper back and that we have their pelvis stable on the table. The first thing we're going to do is we're going to ask Stacy to lift this leg. I'm doing so by tapping on these quads, and as Stacy lifts her leg into 90 degrees flexion, we're going to make sure that her knee also stays open at 90 or 95 degrees better, because once she closes that leg, we are not going anywhere. So we need to keep that knee open. The other thing we're going to do is slightly bring Stacy's leg away to the outside of her body, because if we stay in line with her body, Stacy's body is going to get in the way of a full range of motion stretch. So what we have now is 90 degrees flexion, the knee opens slightly at 90 degrees or better, and her ankle is going to stay loose. And I'm going to ask Stacy to move her hand for 1 second. I'm going to ask her to bring this knee right here to this shoulder. And just before Stacy moves, I'm going to rotate my body so that I'm facing in the direction that Stacy's moving. And as Stacy brings that knee for me, without pushing down with her heel, just using her quads, I'm going to shift with Stacy. And at the very end, give her a slide assist. 1, 1,000, 2, 1,000, and then we're going to come back up. So the assist is not me pushing with my upper body, it's me shifting and going along for the ride that gives the assist for Stacy. So once again, we're going to have Stacy bring this knee right here towards this shoulder, and she's going to keep the inside of her thigh right up along the outside of her body, right? So now she's going to use that quads right here. We're going to tap it and have her bring that knee straight down, and as she moves, I'm going to shift with her and give a little assist. 1, 1,000, 2, 1,000, and as we come back, I'm going to shift back into my rear leg. We're going to make sure that Stacy's still breathing, because of course it's very important, and I don't feel like practicing my CPR right now. So now, Stacy, we're going to take a deep breath in. You're going to bring this knee straight down to that arm, and all the way down. And I'm going to shift with her. 1, 1,000, 2, 1,000, and back. Does everybody see the increase of what we're happening with Stacy? One more time, Stacy. You're going to take a deep breath in, and as you blow it out, you're going to bring this knee right here towards this shoulder, and all the way down, keeping that knee open. 1, 1,000, 2, 1,000, and back. And that is our first stretch. Stop for a second. I didn't name, what the hell do we call the stretch? Hip flexion. That's all it is hip flexion. That's okay. That's our first stretch for today, which was hip flexion. I can fix it with the next one.